This is the sub-Q return for Lainey Adams. I'm in my correct uniform, badge, stethoscope, pen light, pen, watch, shoes. I'm going to start off in my med room. I will wash my hands. Show you my med room. I have my MAR, my medications, syringes, labels, alcohol swabs. So I'm going to locate my MAR, which I have right here. This is Fanny Fundamentals receiving heparin 1200 units. So I would locate my heparin. I'm going to use the 10,000 units per 1 milliliter heparin and calculate the dose in milliliters, which will be 0.12 milliliters. I'm going to choose a syringe. For this, I'll be using a heparin or a tuberculin syringe. So this little guy right here. I'm going to fill out my label. So I have Fanny Fundamentals 11355 receiving heparin, the 1 in 10,000 strength, 1200 units subcutaneous, which is 0.12 milliliters. Added by me, 11/16/20 at 1 o'clock p.m., 1300. And this medication expires on 2/28. Have all that. Now I'm going to get ready to drop my medication. I'm going to open the lid of my vial and clean it with an alcohol swab for 15 seconds. Okay, and I'm going to get out my syringe, loosen the top, draw up some air. I'm going to do more air than I need so that I can get out my bubbles. Then I'm going to inject that air into my syringe and drop my medication. To get rid of all of my air bubbles. Recap my syringe. And then check my label, my MAR, and my syringe. So I have Fanny Fundamentals 11355, heparin 1200 units, 0.12 milliliters subcutaneously, added by me on 11/16/20 at 1 p.m. And this is not expired. I'm going to do my best to show you what I have. This is just not working the way that I want it to. Now I'm going to attach my medication label without covering up any of the markings on my syringe. Like this. And then I'm going to head into my patient's room. I will bring my MAR and my medication, knock, wash hands. Hi, my name's Lainey. I'm going to be your nurse today. Can you please verify your name and your date of birth for me? Okay, Fanny Fundamentals, 11/3/55. Do you have any drug allergies, Fanny? No? Okay, and what about latex? No. Okay, wonderful. All right, I'm going to do my last 6 rights. So we have Fanny Fundamentals, 11/3/55, receiving heparin, 1,200 units, 0.12 milliliters, subcutaneously, stat. This medication is not expired, and I will document this all later. Okay, I'm going to get my supplies ready, so I'll open up an alcohol pad, loosen the cap on my syringe, and put on some gloves. Then I'm going to choose the location for the subcutaneous injection. So for subcutaneous, we can do it on the abdomen, the back of the arms, underneath the scapulas, or the lateral or posterior thigh. For this, we're going to be doing it in the abdomen. We will stay 2 inches away from the umbilicus and 1 inch away from any contusions, tattoos, injuries of any kind. So I'm going to bunch the skin, cleanse with an alcohol wipe starting in the center and moving outward in a circle. I'm going to let that dry. Then I will remove my cap from my syringe. Alright, Fanny, you're going to feel a little poke. 90 degrees. Insert my medication slowly. Wait for 5 seconds. Unbunch the skin. Remove the needle. Cap it and dispose of it in the sharp spin. Then I will check the injection site for any oozing or bleeding. If there was any, I would put a small gauze pad on it. Then I will take off my gloves, wash my hands, and I'm finished.